I suggest we get started. So welcome everyone to part 2 of our webinar on reducing the impact of procurement, results from lifecycle analyses of key items of the humanitarian sector, in which we're going to present you the key results of the analysis that we performed in collaboration with ICRC and 2 departments of EPFL. My name is Sonja Schmid, and I'm the head of the solutions team at the Climate Action Accelerator. Before we get started, just a few practical informations. We're gonna, so we have around 1.5 hours. We split the presentations into 2 batches. So we'll first present a first set of 3 LCA results, then we have time for around 10 minutes of questions. And then we present the second set of 3 results, and again, we have around 10 minutes for questions. The webinar is recorded. It will be available on replay on our website and on our YouTube channel. And please note that your audio and video is off by default. And to ask a question, please write it in the Q&A section in your panel. And I will read out the questions during the session. So please feel free anytime to add questions into the Q&A section. Translation to French or any other language is available via Zoom. Here is a short info on how to activate subtitles on Zoom. So basically you go on activate captions, or if you Zoom in French, afficher les sous-titres. And then you select the spoken language, which is of course English, and then select the language you want to translate to. Just a few words on the Climate Action Accelerator. The Climate Action Accelerator is a non-profit initiative based in Geneva. We work in priority with the aid, health, and higher education sector. We support our partners and our networks in reducing their carbon emissions by 50% by 2030, in line with the Paris Agreement, and pursuing a net zero trajectory, as well as moving towards greater resilience in their operations. We have currently more than 30 partners on board. All of our partners from the international aid sector committed to reducing their emissions by 50% by 2030. We also work with national actors where the focus is more on creating greater resilience and moving towards a low carbon development path. And we also have a specific projects led by our health team, again, more in low and middle income countries, and again, moving both towards greater resilience and towards a low carbon development path. So I'm happy to introduce today's speakers. With us today are Ashima Rajput. She's a computer engineer and environmental analyst at the EPFL Laboratory of Environment and Urban Economics, LUR. Paulo Svenje, he's a carbon metrics officer at the Climate Action Accelerator and accompanied a number of our partners, both in their carbon footprint as well on their carbon trajectory modeling. And then I will be your moderator for today. We had initially also planned for Carmen Garcia Duro from the ICRC to be present at the webinar today, but she unfortunately had to attend some urgent family matters, so she's not able to join us for the discussion today, and we'll try to cover her part as much as possible. So before I hand over to Ashima, just a quick introduction to the project. So the goal of the project is to design methodologies and perform lifecycle analyses of high impact items of the international aid sector. There are basically 2 key project goals. One is to identify key strategies to reduce environmental impacts of these analyzed products. And the second one is to build a greenhouse gas emission factor database and basically improve the measurement of greenhouse gas emissions per item, as many of the emission factors that are available from public databases or any other environmental impact databases are not adapted to the specificities of the humanitarian sector. So we're also trying to fill a gap in that sense, and improve the measurement and monitoring of emissions from key products of the humanitarian sector. The project was conducted with a quite, I would say, strong scientific and technical expertise. So we had 2 laboratories from the EPFL, so the Technical University in Lausanne, one a very reputed university in Switzerland. We have the Essential Tech Center that is essentially working with humanitarian actors to use technology to drive sustainable development and support humanitarian action and foster peace. And then the Laboratory of Environmental and Urban Economics that conducts research on the public and private management of the natural and built environment. And we also had Damien Friot, one of our accelerator's associate experts and a lecturer at EPFL as an associate expert to the project. We analyzed 13 items as part of this project. And so we split the presentation of the results into 2 webinars. We already held one webinar in early June. You are able to access the recording and the slides on our website in the webinar section or through the project page. And then today we present the remaining 6 results, namely hygiene kits, face masks, coveralls, hygienic pads, mosquito nets, and ready-to-use therapeutic food. So I hand over to Ashima to get started with the presentation of the first set of results. Thank you.
Thanks, Sonia, and thanks everyone for being here. So I'm going to get us started by speaking a little bit about our life cycle assessment process. As you would know, the life cycle assessment that is conducted on any product or process or organizational activity covers everything that happens in the life cycle of a product from the time that its raw material has been taken all the way to the disposal of the product. But what are we measuring as part of this project? So in the next slide, you will see the methodology information of our project. So our results that cover the raw material stage, the production stage, the transportation, or as we call it, supply and distribution stage, the use stage, and the disposal or waste management stage are measuring 2 main categories of impact. The first is climate change, which is being measured by global warming potential over a period of 100 years. And the second is a grouped impact category called impact on human health. These 2 impact categories are set by the European Commission's Environmental Footprint 3.1 indicator system. And inside of this system, there are many other impact categories covering other areas of impact like nature or water use. But these are the 2 that we have selected for our study. The second one, impact on human health, actually consists of 5 actually sub-indicators. The first being human toxicity carcinogenic and the human toxicity non-carcinogenic, and then ionizing radiation for particulate matter formation, photochemical oxidant formation. What all of this comes down to is direct impacts to human beings and their health that are being measured by various ways. And as part of our life cycle assessments, we have weighted them and normalized them to create a combined score, which we are calling impact on human health, also using the same methodologies laid out in the EF 3.1 system as given by the European Commission. And so in the documentation of our LCAs, you will find the links to these methodologies and these approaches and the source documentation on the European Commission's own platform for the same things. And then finally, we have an experimental projection of impact that we are using that's called plastic leakage, where we would like to also track how much during the course of the life cycle of the product or as a direct impact of the activities of the humanitarian supply chain, the plastic material that is being used is being leaked into the ocean and underground waterways. And this is not a widely used indicator, and so it is fairly early stage and experimental, but we are using another team's work and adapting it to our studies. Next slide. Specifically for the disposal stage, we want to model the differences between various waste management methods that are closer to humanitarian contexts. And so in life cycle assessments that may be more catered to Western contexts, you might see disposal methods that are popular in Western countries. But as we know, the disposal conditions, or even to have visibility over how a certain product is disposed, is very precarious in humanitarian contexts. And so we are considering two types of end-of-life methods, the first being managed and the second being unmanaged. And so this is a simple list of end-of-life methods, or disposal methods, as we would call them, that are being treated as scenarios as part of our life cycle assessments. The first being open dump, which literally means if the item was just thrown on the side of the road. Open burning, where it would be collected into pits and then set on fire. Unsanitary landfill, which would be once again a minimally managed, but just collected into a dump and then sent to a landfill. Or a sanitary landfill, which would then indicate a management from local government. So you would send the waste to a landfill that is properly maintained or lined to prevent from toxins being released into the earth. And finally, municipal incineration, which is managed burning, which is something that is followed more in Western countries, but is a methodology that is part of our scenarios. And recycling, which is a modeled or hypothetical scenario that we use for some of our products to see how far we can reduce the impact of the last stages of the life cycle. However, some of these stages are more abrupt than others. So burning the waste, for example, will make sure that there are no more lasting impacts beyond that point. But we know that landfills, that plastic going into landfills, for example, does not break down for thousands of years. So in the scope of our studies, normally we consider the impact on both categories, climate change and impact on human health, for a period of 100 years, with the understanding that like the perspectives might change if we go beyond that. But at the moment, we don't have a proper sort of instrument to be able to map the lasting impact. However, the implications and the assessments that we make are conclusive for any time period in terms of the proportion of impact between these waste management methods. Hopefully it will become clearer to you as we go along, but please ask a question at the end if it's not clear. Next slide, please. So this is a little bit more information on what I was talking about when I talked about plastic leakage. As I explained before, we have any type of waste produced in a country is either managed or unmanaged. And inside the management, it could be recycled, it could be incinerated, it could be sent to a landfill. And inside the mismanaged waste or unmanaged waste, it could be sent to improperly managed landfills, or just littered or sent to dumps. And inside of this mismanaged waste that is produced, a team here in Lausanne has modeled a system of mapping impact that shows the plastic, specifically the plastic waste being leaked into oceans and waterways, which we are using as part of our study. So that's a little bit about the methodology we are using as part of this project. We'll now move on to the results of the life cycle assessments. The first life cycle assessment we are considering are hygiene kits. So these kits are made up of some essential items that are assembled and sent to the field with the function of serving one person per kits. The ICRC has recently created a new version of their hygiene kit, by increasing the quality of some of the products inside, and also the volume of the total kit, so that it can be shipped in lower space. And so we are creating an analysis that compares the old version of the kit and the new version, and mapping the changes between the sub products that are being sent, to show the potential change and impact of the kit. Other than that, the packaging, the kit itself is made with several materials, of course, but are manufactured mostly in Europe, sent by truck and then by ship to our the location of our study, which is sub-Saharan African distribution locations, and where the land transportation to distribution locations or warehousing locations are trucks, basically. For the product and packaging disposal, we have mostly open burning or sanitary landfills for the disposal of the product itself. But the packaging we are mapping to always be dumped or littered, because we want to be very realistic on how these hygiene kits are used. So we assume that the packaging is just thrown away at every product level. Next slide. So what's inside the kit? We have washing powder, which was previously powder form in a 450-gram plastic bag, and now is a concentrate detergent, which is half of its original weight. The sanitary pads that are as part of the kit don't undergo any change, but there's 10 of them. The hair shampoo was originally a plastic bottle liquid shampoo and is now a smaller shampoo bar. The body soap remains the same. There's 2 of them, and they're packed in earlier in a plastic bag and now in laminated paper bag. The razors have gone through a reduction of number. So there were 5 razors in a plastic bag or in the old kit, and are now only 2. And the thing to be noted is that all these changes are maintaining quality of use. So if the 5 razors were being used for 1 month, for example, these 2 razors will also last the same person this exact same amount of time that the 5 were being used for previously. And then we have toothpaste, toothbrush. Toothpaste does not have any change. The toothbrush has gone from being 100% polypropylene or plastic to 50% polypropylene and 50% wheat straw material. And then the toilet paper was previously virgin tissue paper, which was bleached, to now being recycled tissue paper, which is unbleached. Okay, next slide. So before we compare anything, the one-to-one differences between the old hygienic kit and the new hygienic kits are pretty understandable. There's about a 40% difference in the pure the kits between each other. Out of the sub products, the detergent is the biggest contributor of the greenhouse gas emissions in the new kit, and it is covering up to 27% of the total emissions. The second is soap. We presented the soap life cycle assessments individually in our previous webinar, and we explained that soap in our cradle to grave study is including the water and the wastewater that is needed to use the soap. And so due to this this impact as part of the life cycle of the soap is also an impact heavy product as part of this hygienic kit. And so it is the second most impactful product in the hygienic kit when it comes to the greenhouse gas emissions, and then the highest impact when it comes to the impact on human health. The other notably high product in terms of impact are sanitary pads, which are 18% in both. Next slide. So with the assumption that every time that we assume a use life of these products, so if it is 15 shaves for the pack of razors in the old kit, then it is still 15 shaves for the new pack of razors in the new kit. With that assumption, the new hygiene kit has an overall 30% reduction total in greenhouse gas emissions as compared to the previous kit. Out of this, the highest reduction that can be seen is the first two bars of the charts that you have here, the old and the new detergent. And then after that, there's the, sorry, the highest reduction is actually in razors because of the number of razors that is reduced. And then the second highest is the detergent. And finally, the toilet paper has also a significant amount of reduction of impact because of the shift from virgin to recycled toilet paper. Next slide. For impact on human health, it's very similar implications, but the percentage of reduction is a little bit lower. So it's an overall 24% of reduction in impact on human health. The highest reduction is still in razors. It's 61% from previous to the new kit. The second being, again, detergent, and then the final being hair shampoo, by moving from a plastic bottle and a liquid inside that bottle to a shampoo bar with no plastic packaging. The hair shampoo reduced greatly in impact on human health. And the next slide. So we have, as part of the changes that were made by the ICRC to reduce the impact of and the volume and and increase the quality of a singular hygienic kit, we can see that the net improvements that were made to the environmental impact were 30% reduction in climate change and 24% reduction in impact on human health. So there is a correlation between the improvements that are being made on volume or shipping volume and the environmental impact of a singular hygienic kit, even though the perspectives are quite different. But if we were to go further on this path and reduce more the impact of the kit as a whole, our recommendation would be to focus on the highest impact products and reduce their focus on reducing their impact first. So in that list would be washing powder or detergent, which has already been worked on but can be worked on more, soap bars, and then sanitary pads. And I think that's it for hygienic kits. Please, we will stop after 2 more products for your questions, and so let us know if you have any queries. The next product is face masks. So here we are doing a comparison of single-use and reusable face masks for daily wear or non-medical purposes. Our first item is a 5-gram polypropylene single-use face mask, which is a type 2 face mask. It is made from plastic. It's manufactured in China and then sent by sea to African distribution locations or sub-Saharan Africa, let's say. And its lifespan is obviously for 1 use. And it does not have any use phase impact because it is not washed and it is thrown immediately after being used. And since it is medical waste, we are considering open burning or just burning of the waste as the waste process. The second mask that we are comparing the single-use face mask with is a cotton type 1 face mask. Both masks in our comparison are intended for use in a type 1 compliant context, which means by patients and not by healthcare professionals. But this mask is made with cotton, a little bit of polyester and polyurethane as lining. Again, it is manufactured in China, sent by sea to the same locations. And instead of no lifespan or no use phase impacts, we are modeling 20 uses for the cotton face mask. And because of the reusable nature of the face mask itself, it needs to be washed and dried after each use. And then the product disposal method is also open burning for making the comparison simpler. Next slide. So before we compare the lifespan and the function of these 2 masks, just 1-to-1, the single-use masks are about 33 grams per mask, and the reusable masks, because they're heavier, they're made with cotton, and also the lifespan contains some water use. They are about 196 grams per mask. The single-use mask has very, very similar impact breakdown by life cycle to other plastic items. Half or more than half of the impact is taken up by the raw material, which is plastic, and the other biggest share is the end of life stage, which is also very characteristic for plastic products when you burn the plastic. The emission factor of the reusable mask is much higher because it is much heavier, but when we come to comparing it by its use, then the things become a little bit different in our comparison. Next slide. So how are we pitting these two masks against one another? So as I explained already, the raw material is different. It's cotton and virgin polypropylene for the baseline mask or the single-use mask. There's also 20 laundry washes that are considered in the reusable mask, as opposed to no use life emissions in the baseline mask. And everything else has been kept the same, just to show the impact of these two key stages in the lifespan or the use of these masks as a type 1 mask. Next slide. So switching from a disposable mask to a reusable face mask reduces the climate change impact by 70% for the functional unit of 20 uses. So a reusable face mask, if you assume that it lasts 20 uses, and then you compare it with you having to use 20 disposable face masks as opposed to one reusable face mask, the consequent reduction in climate change impact is 70%, and the reduction in human health impact is 42%. Again, this does not cover face masks used in surgical units or medical contexts, but it covers more the patient use or daily wear context of the comparison. The emission factors that we have created are usable for creating an impact assessment of the masks by themselves. But when you compare them, we are comparing them for daily wear use. And for daily wear use for patients, the comparison shows a significant reduction in impact when switching from disposable to reusable masks. Next slide. Again, the 70% reduction in climate change and 42% reduction in human health is dependent almost entirely by the reusability of the masks. And so if the masks are reused more than 20 uses, this percentage could be higher. If they're reused less, this could be lower. There's also a logistics system to be considered to collect, wash, and track the number of uses for each mask throughout its lifespan, which needs to be taken into account. And finally, we are not tracking water use as one of our impact categories as our study. So this is also needs to be taken into account, that if a study is done for the water use differences between single-use and reusable masks, that might change the perspective. But within the climate change and impact on human health perspectives, we have a significant improvement in and impact reduction by doing this change. Thank you. So that's face mask. Please don't hesitate to add your questions in the Q&A section if you have questions already. We'll address them after this one. So the next LCA that we will be talking about is a comparative LCA between single-use and multi-use coveralls. So this analysis is aiming to compare two options for a medical intervention coverall as used in the Ebola context. One is polyester, polypropylene, both are actually polyester, polypropylene, rubber, and polyethylene tetraphthalate, or PET suits. But one is a single-use coverall that needs to be disposed of every time, and the other is a multi-use coverall actually researched and built as part of a different project in the EPFL Essential Tech Center, which we will explain a bit later. Both coveralls are manufactured from locally sourced materials in China and transported to the field by sea. The single-use coverall obviously has one use, and then the multi-use has 100 uses. Same as the mask, the single-use coverall doesn't have any usage processes, and the multi-use needs to be washed with tap water, soap, and then chlorine after each use, since it needs to be sanitized properly. And both items are going to be burnt at the end of their life to show a clearer comparison. Next slide. This is the Smart PPE reusable coverall product that was designed by the EPFL Essential Tech Center and Médecins Sans Frontières to replace single-use coveralls in the Ebola response context. We are using this designed coverall as our reference point for this comparative assessment. And this smart PPE is not yet available on the market, but it is ready for production. So the documentation of this LCA has all the appropriate links and contacts to get in touch in case you want to know more about this smart PPE project and the product itself. And another thing to be noted is that as per the previous study conducted by the EPFL Essential Tech Center, the hourly cost of intervention is also reduced in the case of smart PPE as compared to a single-use coverall by a factor of 6. Next slide. So compared to each other without any function, the single-use coveralls are about 1.3 kilograms per unit, and the smart PPE are about 19 kilograms per unit. Of course, this is due to the water use and other such items that might be considerably more impactful in the smart PPE case. Since both are plastic products, the raw materials are significant contributors to their overall life cycle impact. But since single-use coveralls don't have a use phase, for them, 50% of GHG emissions and 53% of impact on human health are coming from the raw material, whereas for smart PPE, it's more 32%, 24% for climate change and human health. The use phase in smart PPE is 24% of the climate change impact and 21% of the human health impact. And then at end of life or in the disposal stage, both are quite impact intensive, both PPE because of the plastic material being burnt. For the single-use coverall, it's 27% of the overall GHG emissions. For the smart PPE, it's 18%, and so on and so forth for impact on human health. Next slide. So in terms of our comparative analysis, we are going one step further in, between the single-use and the reusable coverall. Apart from the reusability, we are also considering a recycled polyethylene single-use coverall just for comparison. In the production stage, we are considering an average energy mix and a solar energy for production scenario. Of course, in use life, if it is a reusable coverall, it needs to be washed, and everything else remains the same for our analysis. Next slide. So if we are to compare both products for 100 uses, moving to use reusable coveralls reduces the GHG emissions by 86% and the human health impacts by 79%, as opposed to the single-use coverall. Inside the coveralls themselves, if you substitute the virgin material with recycled material, the impact reduction is around 25% in both categories for the single-use coverall, assuming that there is no loss in material quality, and then the coverall is still lasting as long as it needs to last. For the reusable coverall, it would lead to a 9% reduction in greenhouse gas emissions and a 7% in human health, because raw materials are a smaller share of impact for the smart PPE. Next slide. For the energy supply, or let's say energy used in production, if we were to switch to renewable sources, this would reduce the greenhouse gas emissions of the single-use coverall by 14%, and human health impact by 11%. But again, like compared to the smart PPE, as you can see in the graphs in front of you, that would make very little impact, even if you were to combine this benefit of better energy with the previous benefit of recycled material. It would still be a maximum of 30 to 40% net reduction in both categories, which compared to the 85% reduction that can be caused just by switching to the smart PPE is not comparable enough to be a valid action. Next slide. So if we were to sort of pit all the scenarios against each other, you would see the first row, the first 5 or 6 scenarios being the single-use coverall, and the final ones being the smart PPE. Once again, have no sort of competition between the usability or the lifespan of the single-use coverall and its consequent impact over 100 uses. Most of the time, all the actions that we saw reduced the impact by somewhere between 10 to 30% without switching all the way to the smart PPE. However, if the products were sent by air freight, then that would drastically increase the impact, which you can see in the middle bar over there, with the purple section being really high. So that's the only scenario where the impact would go up. However, with the smart PPE, the maximum reduction that can be achieved is using the recycled smart PPE and using renewable production for producing the smart PPE. Next slide. The same implications and assessments stand for impact on human health, although the changes in proportion are not as much because the chemicals and the materials used hold more ground in human health and also the end of life or disposal stages. And so the changes that are being assessed as part of this study have proportionally less impact, but still have the same assessments as climate change, which mean that the smart PPE is several factors better, but the single-use coveralls can be improved by using recycled material, given that the quality of the product is maintained. Next slide. So by switching from single-use to reusable coveralls, as I mentioned, the climate change reduction is 86% and the impact on human health reduction is 79%. This can be further improved by making some changes, but as far as the study is concerned, this is already a significant enough change to move quite towards being the priority impact reduction action. However, it highlights, so we would like to highlight that we are focusing on climate change and human health. Other impact categories like ecosystem quality and water usage are not being covered as part of this study. So, for example, the reusable coveralls 100 uses that are being mapped as part of this study would require over 1,000 liters of water for cleaning, plus chlorine. And so if water use was being mapped, that would also possibly change the perspective of the study. And there is also a large logistical project that is entailed with the use of reusable coveralls. So with that in mind, the first step in the direction is to switch to reusable with all of this feasibility being taken into account as like a larger consideration. Thank you.
Thank you very much, Ashima, for the interesting presentations. And I think it's, yeah, I'm always happy when we present the results, because I think they clearly show quite significant reduction potential, and also they clearly show the importance of taking into account the whole lifespan, and also the importance of increasing the lifespan of products as one of the key actions to take. We have a few questions in the chat. Maybe as we just finished with the smart PPE, we start with that one. So There's a question around, will the smart PPE kit be available in any, I assume, HPC, Humanitarian Procurement Center? Maybe we pass the question to Paolo, as he was more on the technical details.
Thank you. Thank you, Sonia. So actually, the Smart PPE is a product that had been made for studies by the EPFL. So far, it's had been made as an experimental product, so I don't think it's available for organizations. But I think the message behind this LCA and its presentation is to highlight that it's worth it to go for this kind of products and to push manufacturers to go for this kind of product, even so in a climate and human health point of view, but also in an economical one, as it other study conducted before about smart PPE demonstrated that in many contexts and pandemic contexts, for Ebola, for instance, it has also big economic health advantages to go on this option.
And if anyone is interested in getting more information, we're happy to share. I can add them in the chat later. The link to the Smart PPE website, and if you would like to know more, there's also a contact that you can get in touch with. There are more technical sheets that are available. So yeah, happy to add that to the chat in a moment. Are there any financial implications, comparisons? So I assume this now concerns all the products. I would say it depends. Unfortunately, Carmen from ICRC is not with us today. She is in a much better position to talk about it. We know, for example, for the hygiene kit, I believe there was no financial implications or even a cost reduction. So there are some examples, or the same, it's not part of our study, but ICRC also worked on an eco-design tarpaulin, where there were actually cost savings that came together with greenhouse gas emission reductions. But it really depends. So it really has to be looked at for every single product if there's a cost implications, and in some cases there are even savings. So there's unfortunately no clear answer on that. And then for hygiene kits, there's a question if ICRC considered moving to changing them to reusable. So from what I know, again, unfortunately, ICRC is not with us today. From what I know, there's already a reusable sanitary pad available on the items catalog, but it really depends on the context and notably on cultural acceptance of reusable sanitary pads. So it really depends on that. It depends really. So, and I think that's also an important point or a message that we try to get across with our project. So whilst of course we're advocating for impact reductions, be it on the environment, climate, like carbon emissions or human health, but at the same time there are some operational realities that need to be taken into account, and we're not advocating for reducing humanitarian aid or not taking into account the needs of beneficiaries. Rather the contrary. So yeah, all I can say is I know they're available, but for ICRC, I believe it strongly depends on the context if they're being used or not. And then one last question on the effectiveness of the single-use face mask versus the reusable mask, and I hand that over to Paolo again.
Okay, thank you. So yeah, about this mask. So it had been explained that it's not intended to be surgical mask, but only used by patients in waiting areas and so on. So for this kind of use, the norms qualify the type 1 mask to be used in this context. And so the reusable mask that had been assessed is a type 1 mask, while for the single-use one, it had been compared to a type 2, because actually, even in this kind of context, we observe that type 2 masks are used by patients in waiting area. So actually switching from reusable mask to single-use mask, sorry, to reusable mask will not have the same specification, but it will still be above the accepted one following the medical norms on this topic.
Perfect. We don't have any more questions in the chat. I suggest we move on to the next set of items. And I hand back over to Ashima.
Thank you. Okay, so we'll move on to our last 3 items, and the first of them are hygienic pads or sanitary pads. So this is a comparative analysis between a single-use and a reusable sanitary pad. The single-use is made largely with polyethylene plastic, a little bit of paper in there. We are basing our study on a existing wider life cycle assessment done on many menstrual products in different contexts, which are cited in our project documentation that can be found on the Climate Action Accelerator website soon, I think. But based on the study that we used, we are modeling a certain energy and water use for the production of each pad. We are considering local production and purchase for the disposable pads, as most of the disposable pads are bought nearer to wherever they are needed or needed to be distributed. However, for us, we are considering like near being that it doesn't need to be imported by from another continent. So it could be from another country, another region of the continent, but just by truck. Then for the disposable pads, our measure of use is 10 pads per period. Again, this is lower than what other studies have considered, but we want to consider it as twice a day for 5 days because we want to measure a scarcity context. So we want to map the pads in a way that we know that the people using them in humanitarian contexts are going to be are not going to want to waste them. So it will be used in a scarce way. And then for the usage processes, we are measuring the impact of washing your hands after every time that you use these pads, so twice a day, as part of the life cycle of this pad. And then for the disposal, there is just dumping or littering for everything, and then wastewater creation, like generation of wastewater because of the hand washing as part of this pad's life cycle. Next slide. The next product is the reusable pad. So it's made from cotton and a little bit of polyester. And this one we are considering to be imported from India, as per some information we have from the field from the ICRC team. And so it will be coming by sea, and before that going to the port by train, as is normal in India. And then finally, when it reaches the African continent, it will be going around in a truck. For the reusable pads, we are mapping a utilization of 2 pads per year used interchangeably during the period. And so the duration of the period continues to be 5 days. And so every time basically we are measuring that every day the reusable pad is changed, and every day the next pad is used. And so once the first one is being used, the second one is being washed, which we are measuring with 5 liters of water and some soap. And then when the next one is used, the first one is being washed. So 2 pads are being used over the course of a year for each period interchangeably. And then all the disposal assumptions are the same. Next slide. So with the water considerations, in the case of the single-use hygienic pads, the use of the water during hand washing, and in the case of the reusable pads, the use of the water during washing the pad itself. It is overwhelmingly the biggest segment of the impact for both, but for disposable hygienic pads, it's 55%, 61% of the overall impact, the second most impactful category being the raw material of plastic, of polypropylene itself. And for the reusable pads, it's far and away, it's 80 to 90% the impact of the entire life cycle of the pad itself. The second highest category is for reusable pads, the burning of the pad itself, because it's made from cotton, and the weight itself is quite significant in terms of the disposal method. One-to-one, the emission factors of the single-use pad and the reusable pads are quite different, almost 10 times, more than 10 times as much for the reusable pad. However, as we explained, for the course of a year, you need about 120 single-use pads and only 2 reusable pads, which are used interchangeably. So what does that mean in the sense of the life cycle comparison of the life cycle? We see in the next slide. So for the functional unit of 12 periods, so for the measure of 12 periods, assuming that 120 disposable pads and 2 reusable pads are needed to fulfill this 1 year period, the climate change is reduced by 82%, and the impact on human health is reduced by 80% by switching from disposable pads to reusable pads. As you can see here on this graph, this basically nullifies the raw material and almost all nullifies the waste management stages of the life cycle impact of the sanitary pads itself. The only thing remaining is the water use, which is also significant because you are changing the product less, yes, but you are still using quite a lot of water as part of the process. We often hear at this stage that water itself may not be a considerable part of the life cycle of the pad for some people. And so if we were to remove water from this equation and we were to just consider for 1 year, you would need, in a scarce scenario, in a humanitarian context, 120 disposable pads and 2 reusable pads without thinking about even the water use that is coming into consideration. We would see something like what's on the next slide. Like this, which is an even greater reduction. So without the water use part of our study, the comparative analysis shows a net 96% reduction in both categories, purely because we are switching from 120 single-use pads to 2 reusable pads. We think that the water use is very considerable because it puts into perspective the things that reusable pads brings to the equation that were not there before, which is the water use. But still, this is also to be considered if this perspective is looked at. And then under this perspective, without the water use, if you were to use renewable energy to produce the reusable pads over the course of its entire lifetime, you would see a 7% reduction in greenhouse gas emissions from a reusable pad to a reusable pad made with solar energy, and a 4% reduction in impact on human health. This is not that big because production is not a big part of the overall life cycle of either of those pads. And in the previous perspective, with the water use put into consideration, this change, which is done by changing the energy from average Indian mixes to solar energy, is less than 1% for both categories. So it is not considerable enough to be impact reduction methodology. Next slide. So in conclusion, the type of hygienic pad is really the biggest key to reducing the impact of the item. When assuming the effective reuse of the pad, in this case for over 12 periods, you see 82% reduction in climate change, 80% reduction in impact on human health, with consideration of water impact. However, we have not considered the impacts to local ecosystems and the water systems, which can be studied to expand on this result. because the disposal of these hygienic pads are assumed to be dumped. And so to go beyond this point would be to expand on the perspective of the water footprint or the ecosystem quality impact on this process. Thank you. And then finally, I give it over to Paulo for our last two products.
Thank you, Ashima. So yeah, we will go for mosquito nets first. So just before a little word saying that it is HCA made thanks to the work and the information shared by United that did some life cycle analysis on key medical products. So we use this information as a base for our analysis today, and we assess the impact of some scenarios that we will present after. Next slide, please. So this HCA is comparing two different nets, so the PET1 and the PE1, nets that are distributed in medical in field context where malaria is present. So it's both net with XL format, for double two people bed, and considering an insecticide is as alpha chlormetherine, and chlorofenavir that are both in the net. So nets are packaged by 50 in bags with PE film and packaging tape, and they are manufactured in China. All the manufacturing processes are modeled as electric consumptions, and we assume a distribution from China to Africa by sea, and last kilometers between the seaport and the beneficiary by truck. About lifespan, it's important to note that in our scenarios, we consider that the PET nets are lasting 2 years, even if it's designed to last 3 years because it's a WHO recommendation, and it requires to the insecticide to last 3 years. It had been observed in the field that the PET nets are much more keen on having holes, preventing a good functioning, and then need to be replaced before the PE net. So that's it. For the usage processes, we didn't model it in this study as it's not something that kind of happens a lot on nets because washing is not always mandatory. And about the waste management, we consider an open burning both for the products and the packaging on the nets. Next slide, please. So to explain a bit more the differences between PET and PE nets, you have two pictures showing at the microscope the differences between the two items. So basically, polyester is yarns of multiple filaments, so it make it more hard to fix in order that it's not only one yarn. And for the fabrication process, the insecticides, the mosquito nets are coated in the insecticide. Why for the PE nets, it's kind of an alloy made by the plastic and the insecticides that are extruded together, making the insecticide incorporated in the lin. Next slide, please. So the first results for the baseline scenarios highlight that without still looking for the functional unit and the lifespan, that the impacts between PET net and PE net are quite the same, about 4.5 kilos per unit for the PET1 and 4.2 for the PE1 on the cradle to grave. It's important to mention that the main impact for the raw materials is coming from the plastics. Insecticides account for 2 to 3% on both climate change and human health impact. and the repartitions of the impact among the two nets are kind of the same, highlighting that as the extrusion process is quite more intense in energy for the PE1, we can observe a biggest share of impact linked to pollution, both in climate change and in human health. And about plastic leakage, we consider that it's incinerated for the mosquito, so it avoid any plastic leakage. While for the packaging tape, it can cause some plastic leakage in the ecosystem. Next slide, please. So our analysis try to model different variations for these two products. So we will model the recycled raw materials variations, also in the production, assessing what will be the impact if we use renewable energy, and we will also assess experimental scenario highlighting the impact of recycling for this kind of products. And also a different path for supply highlighting the importance of good planification. So next slide, please. First, going on the figures, note that this had been plotted including the functional units. So we can see, because the PE net are intended to last longer, that even if we compare item by item, the impact is quite the same, but while adding the lifespan dimension, PE net are assessed, to go with PE net can reduce the impact by 40%, about 30% in GHG emissions and about 47% on human health. And we made scenarios about materials, assessing what will be the impact if we consider recycled material for doing net. Just mentioning that it's not completely feasible to go for 100% recycled materials because of stabilities of the product, but the idea here is to assess the size of the levers in a way for going in these directions. So going on recycled on recycling material can draw reduction about 25% on PET and 20 on climate change and 20% on impact on human health, and for the PE net about 17% between the baseline virgin PE net and the recycled one on climate change, and 10% impact on human health. Can go next slide. So about waste management, as we can see that the share of waste management impact is quite important for this product, as it's mainly made of plastic. We consider to assess the impact that would be recycling process for this kind of items, and even if this kind of plastic recycling facilities might not be available in all the contexts, to avoid this, we try to model, okay, what happens if we bring back the nets to Europe where there are facilities to recycle these items, even if it's completely not feasible in an economical point of view, but just for the climate and human health impact perspective. So it results to reduce about 20% the impact of the nets if instead of being burned at the end of life, they are collected and then recycled. So it's an important lever to take into consideration, as it can draw to big reductions. About, and you can go on the next slide. Sorry, thank you. About energy, so switching to renewable energy is also an important lever for net, especially for the PE1, as the process is more energy intensive. The reduction that we can accept going through renewable energy are about 1/3 of the climate change impact and 30% on the impact on human health, because our baseline scenario consider the net is made in China, so with kind of high coal intensity in the energy. And for the PET net, so the the baseline that I presented before. So about 25% of reduction in the climate change impact and about 20% reduction in human health impact. Can go on the next slide. Finally, a slide about what will be the impact if we supply the net by air instead of the sea, as we model in our scenario. So here we can see that it will be kind of catastrophic to go on these options because it will increase the impact about 50% for both nets, so 46 and 47 on climate change, and about 30% on human health. So saying that even if we make all the effort about waste management, raw materials, energy, if we have to supply net by air, it can destroy all the earnings. So highlighting the fact that it's important to maintain a sustainable supply chain in a way. Can go on the next slide. So here we are a summary slide on all the different impact for the different scenarios for the on the climate change. You can see at the end 2 scenarios with all the variations presented combined in one, showing in a way the impact of the best possible net. So with recycled materials, with renewable energy, and at the end of life, recycling of the products, and we can have up to about 70% of predictions going from the baseline scenarios to the best possible net. And yeah, in the next slide, you can also see the impact on human eggs, having more or less the same order of size, a bit less impactful, like a bit less of impact at the end with the best possible net, in the way that recycling process, even it saves a lot of carbon, are not that how to say, make not as much earnings as on the climate change on human eggs. So it's why the reduction are a bit lower. So you can go on the next slide, please. So in summary, the first lever to work around the nets is to switch from PET to PE because it demonstrates better lifespan and so less impact on a functional unit of 3 years on GHG and in human health impact, so about 38% and 47%. Then to go to recycled materials is also an important lever, as it can save up to 24% in the GHG emission for PET net and 17% on the PE1, and both and also in human health impact, it can go to interesting reductions. Then going for renewable energy for production instead of the one available on the grid can also save about 1/4 of the baseline emissions for the PT net and 1/3 for P net, and 20% so for PET human health impact and 30% for PE human health impact. Can go on the next slide. And so yeah, this is like a disclaimer saying that the scenario we modeled is like optimistic, trying to assess the impact of each levels, and that might not be all combined with realistic way of processing, especially for recycled material that actually the market is, even if all manufacturers want to go to recycled materials, the market cannot handle it. So this is related things that have to be taken into account. And the same way that for the recycling, even yeah, the scenario was to highlight the impact of recycling for these products, even if the way that we model it is not realistic at this day. So that was it for the Mosquito nets, and we're about to go on the RUTF, so the rapid use therapeutical food. So also this ICA as a Mosquito net one was based on other ICA that had been published, and especially thanks to Nutriset, so RUTF manufacturer, that provide us data to base our ICAs on. So yeah, thank you. So giving a bit of context, so the RUTF is like emergency food rations for malnourished people. It weighs 92 grams, and it's mainly composed of milk powder, peanut paste, vegetable oils that can be palm oils, sugar, often from bedroots, often from sugar cans, and other ingredients as vitamin additives and so on, giving all the nutrition needs for malnourished people. It is packaged in a PET and aluminum foil sachet and then put in a cardboard. Our baseline product is manufactured in France, and we modeled the production as the energy it consumed to produce one sachet from the raw material. We assess a transportation chain from to truck to the manufacturer to the seaport, then sea to the sea transportation to the regional distribution center, and then truck to the beneficiaries. So this product don't have lifespan as it's a consumable, and we do not dispose it. We only consider that the packaging will be burned at the end of the life after the use. Can go on the next slide. So the baseline results highlight that sachet of palm peanut is about 600 grams of CO2 per sachet. We can notice that the raw materials are the biggest contributor to the impact, both on climate change and human health, about 90% in both. We'll make a deep dive on the slide just after, but like milk proteins alone account for more than 2/3 of the impact. So that's a huge point. Then the production is quite low impactful in both climate change and human health impact. We can almost not see it on the chart. The same for waste as for all the materials that go into the product. Only few will become waste. So it's the packaging. And finally, so the supply and the distributions is quite significant without being one of the main impacts. Can go on the next slide. So yeah, this is the same chart but split among ingredients to highlight a bit the share of each one. So as it had been mentioned before, the milk powder account for about 2/3 of the impact. The peanut about 11% on the climate change impact and 3% on the human health one. The palm oil about 7% on the climate change impact and 9% on the human health one. And yeah, so at the end, 90% of the climate change impact is linked to raw materials. You can go on the next slide. So for these products, we modeled different scenarios. We modeled what will be happen if the production is not made in France but directly in Niger, close to the beneficiaries. And we try to model also another scenarios with the same recipe, but considering another milk that is produced with the best practices regarding climate change only, not human health impact, just to assess the first decarbonation levels. Just to highlight that we stick to the baseline recipe because this product, the RUTF, is a product registered in the WHO Codex Alimentarius, so it have to be made with the ingredients we have in the recipe. And so even if there are some studies about other recipe, we didn't assess it in this project. So you can go on the next slide. And yeah, I also forgot to mention that we modeled what would happen if we go for renewable energy in France. And so we are here all the results. So first of all, going from manufacturing in France to Nigeria would lead to very limited reductions, about 1% on the climate change impact and 3% on human health one. To give a bit more details, so for modeling this scenario, we change a bit the supply of some products. Dairy products will still be imported from France because it's not available on the local market from Nigeria, but other products like sugar or palm oil and vegetable oils are available, preventing it to import it, so reducing a bit the transportation size. But as the productions and the energy is more carbonated in Nigeria, it would limit in the reduction, the impact change for 1% only. So even if it's an interesting levers to go to local productions, it do not demonstrate any significant reductions in climate change and human health. About the low carbon milk, as I called it before, in the recipe. So yeah, it can be part of the strategy to source better products. You can, yeah, still the same slide. To source better products. So going with the lowest available milk, the lowest impactful milk available in our calculation base database, we can accept a reduction by 11% on the impact. Saying that it will reduce the climate change impact, but increasing the human health impact, because basically it will be milk produced by open pasture cows, and so it will be less intensive in terms of energy and especially for feedings the cow. But in the other hand, you will have much more dirt outside that will come in the ecosystem, and so that will have a bit more human health impact. About energy, if we go on a full renewable energy for RUTF productions, it will have very marginal savings, as in our baseline scenario, the manufacturer location is in France and the energy on the grid is already decarbonated. And also as the impacts of the production is quite low regarding all the impact of raw materials, supply and distributions, and so on, it will be very low. And just highlighting that all these scenarios do not demonstrate big reductions, as we had, for instance, before with the mosquito nets, where we have other size about 20%, 30%. Here we have about 1%, 10%. It's not that obvious. So yeah, saying that it has to be investigated a bit more to have very clear conclusions about this. Can go on the next slide. Yeah, perfect. Thank you. So the scenario we retain is like to relocalize productions to close to the beneficiaries' places, can reduce up to 1% or 3% the impact of on human health and 1% on climate change. This study, yes, highlights the big contribution of the milk in the overall impact, and try to assess the better agricultural practices impact on the products. But still, as the milk is one of the biggest impacts, exploring possibilities about the recipe and to try to be able to produce RUTF with less milk proteins can be a very big area of studies to reduce the impact of these products, whilst for now it will require update on the Codex Alimentarius because it will not be possible. Just also adding a note that the results of our studies had been made with the last version of EcoInvent, so 3.11, and we had a result about 600 grams for one sachet. It might appear much a bit lower than other studies like UNICEF or also the NutriSets one, and yeah, we investigated this mainly because of the update of EcoInvent. Some products get a very lower emission factor, and we didn't add much explanation to give on it. So saying that yeah, it's made with these factors and it's not the same versions for other LCA that might have been reached before. So that was it for RUTF. Thanks a lot, and I think we'll open the Q&A with Sonia.
Thank you very much, Paulo. There's no questions so far in the Q&A section, so please don't hesitate to add any questions that you might have. I just wanted to highlight one element that you mentioned as well in your presentations, Paulo. It's really about the fact that the results that we're sharing are clearly focused on the life cycle assessment. So it is out of scope of our project to go deeper into deeper assessments about the feasibility, be it in terms of quality, cost, any type of feasibility considerations. We really didn't include them. They are out of scope of the assessment. And then also the element about, of course, you can take our results and start working with your suppliers, but it also involves, that's typically what Carmen from ICRC stresses. It's really requires working with suppliers, also checking on suppliers that they're actually implementing what they're promised that they would implement. So I really wanted to stress that that part again, that it's really about how can we reduce the environmental and human health impact of these items without also going into these feasibility or more operational questions. We basically just wanted to show what is possible. I wanted to ask a question, as we have no questions in the chat right now. I wanted to ask a question to Ashima regarding the energy use. We saw quite different reduction potential for switching to low carbon energy in the production process, notably also for those that already were present at the last webinar. We had much higher energy, much higher reductions when using renewable energy in the production process. And today they were slightly lower for most products. Maybe you can briefly elaborate why this is the case. I think it's quite interesting.
Yeah, sure. Thank you. So there are two things mainly to consider when we talk about the scenarios that we have treated about renewable energy. The first is where the product itself is made. And so the comparison is only a significant comparison if the difference between the baseline, which is like the status quo, and the end line, which is 100% solar, and we are being dramatic to be able to show this wide range of changes. If it is far enough away from each other, only then there is a significant percentage of reduction. And so for products that first of all take a lot of energy to make, and then are made normally in places like India or China that rely a lot on fossil fuel as part of their regional or average energy mix, that usually tend to show a significant reduction in impact when we switch from the regional market electricity to 100% solar panel powered electricity. That's the first thing. And then the second thing is the overall perspective of the product itself. So the previous set of products that we covered in the previous webinar were very balanced between raw material production and end of life, like their impacts. And so when the production itself is a big enough share of impact, even when you don't consider renewable energy, if the production stage is significant for the product before even any change is made, only then when the energy is switched out with solar, is there a percentage decrease that can be talked about? So if the production, even from the beginning, is not more than 10% of the of the entire impact of the product, then it won't make much of a difference. So those are really two big things. And then finally, today's products are very like consumable sometimes, and sometimes they are medical products where the use phase and the disposal and the raw material are much more in consideration than the production of these products. So that's also something to consider when considering renewable energy for production. But for sure, for essential household items, like blankets and floor mats that we covered in our previous webinar, that was a significant impact reduction pathway, mainly because the production of these items was was a large share of the overall impact.
Yeah, there's a follow-up question, and I assume it also relates to the use of energy. I think assessment results might vary from country to country due to the country context, and I think you mentioned it,
Yes.
Ashima.
So we would assume that mostly our assessments are on track for the humanitarian sector, because most of the things that we have assumed are things that are happening for the humanitarian supply chain. So the products are being produced in India or China if they're coming from outside. If they're not coming from outside, then they're being produced locally in sub-Saharan Africa. And so I would say, generally speaking, the energy implications of these regions stay the same. Like, yes, country to country, sometimes it changes quite a bit. But at the end of the day, like India, China have very straightforward assessments on their energy mixes. And then let's say if we were to switch to Europe, let's say in France or in Switzerland, then it would be a completely different story. So regionally speaking, yes, it changes, but we have made sure to choose the countries of production that are in line with ICRC supply chain and in general the humanitarian supply chain, to make sure that it's not something that everyone has to do when they want to use our study for their own analysis.
Thank you, Ashima. We have a super quick question for Paulo. So for RUTF, milk has the biggest impact. Do you have an idea of replacing the milk by soy protein? Soy protein isolate can change the analysis. Do you plan to do the same analysis on RUTF using soy instead of milk? Maybe just quickly on notably the first part.
Yeah, about the first part. So we didn't assess it as we didn't have the recipe that will be working for assessing the quantities of each product, because we cannot just replace milk proteins by soy proteins. It would require to reshape all the recipe because of the interaction between the ingredients and also the global nutrition potential of the product. So far we didn't make this assessment. But UNICEF, I think, released last year in June 2024 an analysis trying to assess what would be the impact for going from milk proteins to soy proteins. And if I remember well, it drew a reduction about 40% in climate change. This is mentioned in all the technical appendix of the project, but I can find you out the link and put it in the chat in a couple of minutes if it's interesting to you. And about go deeper in the project, Sonia, maybe you have
Yeah.
answer.
So yeah, this will be subject to further funding to be able to do additional analysis. So we would be perfectly open to it, but it would be subject to additional funding. And just to reiterate what Paulo said, we took the decision not to include any like hypothetical scenarios for RUTF, because it's we wanted to stick with the recipe as it is agreed upon right now, or as it is validated by the WHO Codex Alimentarius. So that was the decision we took for RUTF. We came to the end of our webinar. Thank you very much. Thank you very much to Ashima and Paulo for all your work on the analyses and for your presentations. It's been wonderful working with you on the project. I would also like to encourage participants to check out our website, the Solutions Hub. with fact sheets on a number of solutions in all areas, not only on procurement, but also travel and waste management. So there's really a wealth of information on our website, and we will also publish the results very soon, and you will receive the link with the results website as we send out the recording and the slides for this webinar, and we will also communicate on the publication of results very soon before the summer break. Thank you very much. Have a great rest of the day, and do not hesitate to reach out for any questions or comments. Thank you. Bye-bye.
Thanks a lot.
you.
Bye.